Hello, everyone. Dr. Sivarajan here. Thank you for that kind introduction, Tegan. So I'm here today to talk to you guys about overactive bladder and urinary incontinence. So I think this is a topic that everybody knows about, and a lot of times people don't want to talk about. So, I'm kind of here to be the one to do the talking and maybe pass on some education in a non-embarrassing and open discussion here. So if you guys have any questions, feel free to type them in and we can talk about them just like we were one-on-one in the office. You're totally anonymous, okay? So overactive bladder, or as I sometimes like to call it, small bladder syndrome, that's basically a phenomenon where your bladder is not holding urine the way you want it to. What happens is you urinate frequently during the day, you urinate frequently during the night, and perhaps worst of all, when you gotta go, you gotta go. And we call that urgency. The bladder goes from feeling pretty okay to all of a sudden feeling completely full. And before you could possibly find a bathroom, it's overflowing and dribbling out. The only real way to manage that without medical care would be wearing a pad or something like that, which is okay if it's small amounts, but the more and more you leak, the more and more embarrassing of a situation that can lead to. So, I have two offices in the Sun City and Sun City West area. And I take care of this very commonly because, as most people are aware, this is a problem that becomes more likely the older you get. So, a common complaint that people have is they're arranging their schedule around the bathroom. Before they leave the house, they urinate. As soon as they get somewhere, they urinate. As soon as they get home, they urinate. When they walk into a new building, the first thing they do is look for where the bathroom is. People are very, very good at thinking of ways to kind of hack the system and try to live with a terrible problem like this. But that's not necessary. It's not, the 1960s anymore. There are treatments for this because this is sort of a part of aging that everyone has to face, but not everybody has to suffer with. A recent survey suggested that 44% of people are embarrassed to even talk about bladder control problems, which, if 44% of people were embarrassed to talk about their chest pain, imagine what a situation we would be in. People would be having heart attacks left and right. But this is a medical problem like any other. There should be an open discussion about this with your doctor. So the idea here being, if we can sort of expand everyone's bladder capacity or get everyone in a situation where their bladder can comfortably hold urine, they're no longer limiting their life around access to bathrooms. So our agenda today is going to be understanding sort of from a scientific or anatomic standpoint where bladder control comes from and why bladder control can be lost. We're going to talk about different options for management, sort of the same discussion that I would have with any patient in my office, starting from the easiest things to the more sophisticated treatments. We're going to discuss the treatment options one by one, their relative risks and their benefits. And then we're going to spend some time talking about the Medtronic bladder control therapy in specific, because it is a very unique therapy. There's a lot of overlap from all the different medicines and all the other treatments out there, but the device, the Medtronic device, stands alone as it's really the only thing that's targeting the bladder in a particular way, and we'll get to that. So basically, 1 in 6 people has overactive bladder, okay? And quite honestly, that number goes up as you get to higher and higher age groups. Most 30-year-olds aren't waking up to urinate at night. Most 30-year-olds don't, pause a movie in the middle to have to go urinate, but most every 90-year-old does, right? So as you pass through decades, this problem becomes more and more common. So it can affect anybody. There are 25-year-olds that have an overactive bladder, but obviously this is going to be more likely as you age, and it's a good thing to try to get it treated earlier so you have more options available to you. Ignoring the problem can lead to long-term issues. I mean, the most obvious is loss of sleep. You wake up one time a night, no big deal. You wake up twice a night, a nuisance, but maybe tolerable. 3 times a night, 4 times a night, 5 times a night, you're putting your health at risk and you're really interfering with your sleep. We know from sleep studies that most of us have a pattern of sleep where we enter REM sleep about 90 minutes in, somewhere between 90 minutes to 2 hours in. And then in order to feel rested, we need to maintain ourselves in REM sleep for a full cycle. And then we fall out of REM sleep and we need to do that again. If you're sleeping 7 hours a night, which is probably typical, if you're waking up 3 or 4 times a night, you may not enter REM sleep at all during that entire period. I mean, you may if you get lucky one time, but unfortunately, the bladder doesn't really care about REM sleep. So if you're going through a whole night never hitting REM sleep, there's no way you're feeling rested in the morning, and there's no way you're living a normal life during the day. The second issue is loss of confidence. I mean, if you are worried that every time you drink an iced tea or every time you go out of the house for more than 2 hours that you might have to find a bathroom or else you might wet yourself, you're obviously going to limit your activities. You're going to lose confidence in your ability to go out and socialize or shop or do your hobbies. And that's just generally going to lead to poor self-esteem and poor confidence. And then the final thing is, it says here, poor feelings of general health, but I would argue poor health, actually. I mean, any sort of healthy lifestyle or healthy exercise regimen requires us to be able to hold our bladders. I mean, you can't go hiking for 2 hours if you need to urinate every 60 minutes. You can't properly hydrate yourself if you're afraid to drink water because you better find a bathroom or else you'll wet yourself. I practice out in Phoenix. I mean, drinking water is incredibly important to your kidney health, to your heart health, to your general well-being. And quite frankly, most people with incontinence or who have to urinate very frequently fundamentally avoid fluids for fear that something's going to happen. And that is not a healthy way to live life. To put things in perspective, about 37 million adults in the United States suffer from an overactive bladder. Compare that to 12 million that suffer from vision problems or 30 million that suffer from diabetes. You think about how little press or how little fuss is made about overactive bladder and incontinence, compared to some other things like, for example, diabetes. And that's largely because it's an embarrassing topic to talk about. Okay. So what is normal and what isn't? I think a lot of people in my office will say, I'll say, well, do you feel that you're urinating too frequently? And they'll say, well, I don't think so. I feel like that's just regular old guy problems. That's a classic statement that a man will make in my office. And, I think that it may be true that with age, we urinate more frequently, but I don't think that that means that that's normal. Just the same way you would say, well, arthritis or back pain may occur more frequently, or heart attacks may occur more frequently as we age. I wouldn't say it's normal to have a heart attack. I wouldn't say it's normal to have back pain, right? It's because our bodies, they break down a little bit. They lose function a little bit the older we get, but we don't need to live with that. In fact, just like our cars or anything else, we should actually try to fix those problems when they're minor problems so that we can continue to use this body as long as we can. It's not like a car where we can trade it in when the lease is up, So certainly leaking urine in your pants is never normal. It's a sign that the bladder is under significant duress. And it should be addressed in some fashion, or at least we should diagnose the cause of the leakage so that if it's a problem that's correctable, we can correct it before things really kind of snowball to the point where we're in a diaper, okay? Going more than 8 times a day, probably not normal. We're awake maybe 16, 17 hours a day. To have to urinate every 90 minutes or every 2 hours, that's not normal. I always tell patients, you should be able to watch The Godfather without having to pause it to go to the bathroom, okay? Getting the have to go now feeling, okay? That's definitely, that urgent feeling where you better find the bathroom or you're going to wet yourself. That is a significant impediment to a good quality of life. And that is a sign that the bladder is losing its function. The bladder is supposed to be a muscle that is very compliant. When you feel the urge to urinate, it should give you 15, 20 minutes to find a bathroom. I mean, you may remember being in high school, your teacher wouldn't even let you go to the bathroom until your 45-minute period was up and you were between classes, So this idea that I have to go to the bathroom within 40 seconds or within 3 minutes or I'll wet myself, definitely not normal. The next is planning activities around the bathroom. This is, if you find that when you walk in a building, you're looking for all the bathrooms, like Jason Bourne looking for all the exits in a building when he walks in, that's not normal. I mean, is that dangerous? No, that's not dangerous, but it's indicating that your quality of life is revolving around your bladder, which is really not how we should be living life. Same thing for monitoring how much you drink. Doctors will tell you, well, don't drink too much before bedtime. And that's understandable because you're not going to get you're not going to be out in the sun at bedtime. It's okay to limit your fluids in the evenings. But if you're monitoring how much you drink in noontime, 10 a.m. in the morning, because you're afraid that you're going to have to go to the bathroom or you're afraid you're going to lose bladder control, it's not normal. And that's really asking for dehydration and all sorts of other problems. And then finally, using pads to control leaks. A drop of urine here or there, a safety pad, that's one thing. But multiple pads, plural, or diapers, I mean, something is wrong with your bladder. And often it's something correctable if it's caught early enough. So these are signs that maybe we need to do a little more investigation about your general bladder health. So how does bladder control work? When you think about urinating, it seems like the easiest thing in the world. You have to go to the bathroom, you go to the bathroom, right? There's not much to it. But in fact, it's a very complex process that requires multiple steps in order to work properly. So you drink water, okay? It runs through your bloodstream. It gets to your kidney. Your kidney will filter the blood. And if you are appropriately hydrated, it will convert some of that water into urine. Now, everyone's body is different. Everybody converts, you drink a glass of water, some percentage of it becomes urine, some percentage of it becomes stool, right? Goes into your bowels, and some percentage of it you sweat, right? So depending on your particular makeup, that's going to be different percentages for each. So some people will drink a glass of water, and they'll make most of it into urine. Some people may sweat a lot of it off. You can't change that. But what you can change is what your bladder does with that fluid. So ideally what happens is when the bladder is about half full, you first feel like, hey, I could probably urinate if I needed to, right? Oh, I'm about to start a movie, or I could probably urinate if I need to. I'm about to go on a long car ride. I could probably urinate if I need to. But from that point, you should be able to double your bladder volume before you absolutely have to go, okay? And it's that second half where people with overactive bladder fail. They go from, oh, I could probably go to, oh my goodness, I better find a bathroom very quickly. They've lost that extra 50% of stretch that you're supposed to get from your bladder. So what causes these bladder control problems? Well, there's a lot of causes. So the first thing is what you eat and drink. And this is true. If you drink a beer, you're going to have to urinate, right? If you have a giant cup of coffee, you may have to urinate, right? But it's also not fair to say that that's on its own an explanation for, what's going on. So you may, you can think about, well, a 19-year-old can drink maybe 3 cups of coffee and not necessarily have to urinate, right? And a 21-year-old on his 21st birthday can go out drinking all night, not wake up in the middle of the night to urinate, right? So obviously the concept of a bladder irritant is a subjective idea. Certainly caffeine, alcohol, spicy foods, acidic foods, all these things will irritate your bladder, but the degree to which they irritate your bladder depends on your general bladder health, okay? The same is true for medications or supplements. Now, if you take a diuretic, you take Lasix or a water pill like hydrochlorothiazide, you're going to have to urinate, right? It's making more urine. But depending on your general bladder health, you may have to urinate twice in the next 2 hours or 6 times in the next 2 hours, right? That's where, it's going to depend on your bladder's muscular health. That's going to determine which of those things you're at. And then unique to women is the concept of pregnancy, childbirth, or pelvic floor injuries. And I would add a fourth there, which is just gravity. See, as a man, our bladders are in the same spot no matter what age we are. But as women, their bladders can descend into the vagina, and bladders that are lower don't necessarily empty as well and become more irritable than bladders that are up higher, right? So the constant pull of gravity on the organs, particularly if the uterus has been removed or that kind of stuff, that sagging or that prolapsing bladder can certainly worsen bladder control problems in women, okay? So there are many kinds of bladder control problems, but there are three that are very predominant. And these are the three that I think are going to encompass most patients. There's other more unique scenarios, and we'll touch on them, but most people who complain about their bladder have one of these three issues: stress incontinence, urinary retention, or overactive bladder. Now, you can have a combination of these issues as well, but it's very important to really nail down the symptoms, because most everyone, even if they have a combination, will have one more than the others. And you always want to treat things in terms of most bothersome to least bothersome. So stress incontinence, there's a common stat that floats around that 60% of women over the age of 60 are going to have stress incontinence, 70% over the age of 70, okay? It's very common in women, okay? Stress incontinence it's not emotional stress, it's physical stress. It's leaking when you cough or sneeze or laugh or change positions, bend or lift things, okay? The reason why this happens to women is the bladder and the urethra are supposed to be in a particular position. The bladder is supposed to be a little bit higher than the urethra, okay? And therefore, when you urinate, you kind of urinate downhill and everything's good, okay? If the urethra falls more than the bladder falls, right? Because you can't control how gravity affects your organs. So if the urethra falls a little bit more than the bladder falls, all of a sudden you've created too downhill of an anatomic pathway there, and urine is going to dribble through the goalie. The goalie is your sphincter muscle. It's supposed to hold things, but the lower that the urethra falls, the greater the pressure is from above, and you can trickle through and you can leak, okay? Now, men can have stress incontinence too, but for men, it is generally a post-surgical phenomenon. The urethra in a man doesn't fall, so a man's not going to have stress incontinence due to gravity and childbirth and all this stuff. But men can have stress incontinence when their prostate is removed or their prostate is scraped out with a procedure, okay? Because at that point, they no longer have this big prostate that's augmenting their sphincter. And so they can start to leak through there. Now, the first treatment for stress incontinence is Kegel exercises, which women are very familiar with because they sort of deal with stress incontinence slowly over time. Men are usually quite terrible at Kegel exercises because we have no reason to do them unless we lose a prostate, and then Kegel exercises become super important to us, So the next is urinary retention. Okay, so what urinary retention is it's basically incomplete bladder emptying to the extreme. Okay, and most people will empty the majority of their bladder when they're done urinating. A lot of times if you come to a urologist's office, we'll do an ultrasound of your bladder to evaluate whether you're empty or not. And we expect you to have less than 100 milliliters or about 3 ounces in there when you're done urinating, or less than that. Unfortunately, it becomes harder to empty for a variety of reasons the older you get, and that number can go up. But you're considered to be in urinary retention if you're not emptying to a dangerous degree, to a degree where there's so much urine in your bladder, it's backing up to the kidneys, okay? You might say, well, that would be obvious. I mean, I would know that if that were happening. Well, yes and no. If that happens suddenly, right? You took a medicine that plugged you up, or all of a sudden you got a urinary tract infection and you got plugged up, you would know it. But if that happens slowly over time, what can happen is the bladder continues to stretch and stretch and stretch until the sensory nerves of the bladder are damaged, frankly, or simply put, the bladder's too stretched out. If that happens, you may not even feel that you're in urinary retention, which is, of course, the most dangerous way to be in urinary retention, because if you don't know there's a problem, you don't know to seek care, and you'll just simply get more and more stretched out until something catastrophic happens, like urine backs up into your kidneys and you start to get kidney failure, or you start to get sepsis, or God forbid, your bladder bursts or something like that. Okay. So, a bladder ultrasound is one of the first steps that we do if anybody complains of any urinary problem: a weak stream, loss of urine control, excessive urination, discomfort, in the vagina or the tip of the penis or the bladder. The first thing most urologists will do is a bladder ultrasound, because if this is the problem, we need to act quickly. Okay. And, you'll sometimes see commercials on TV of people talking about how they order their catheters from this website or that kind of thing. The people that need to use a catheter in that way are people that, unfortunately, their retention happened very slowly over time. They didn't know it was happening, and they lost any ability to feel their bladder anymore or use their bladder anymore. And now they empty themselves with a catheter. So obviously, this is the type of thing we want to avoid. Okay. And then the third one is overactive bladder. So like I said earlier, overactive bladder is a holding problem. The bladder can't hold as much urine as it should. So what happens? You have an urge to urinate. It leaks out before you get to the bathroom. Somebody turns on the water, your bladder decides to pee. Somebody jiggles the keys in the door, your bladder decides to pee, right? You've lost the ability to hold the urine long enough to get to the bathroom. You have frequent urges to go. You go, we say 8 times a day, you start waking up at night excessively to go to the bathroom, and you start to use pads or safety products in your underwear because you don't know when you're going to lose control, because you don't know when your bladder is going to feel full without adequate warning for you to find the bathroom. The good news? Well, the good news is you don't have to live with it. There are a lot of treatments for overactive bladder. Okay. So the first step is diagnosis. Okay. Diagnosis is actually much trickier than it sounds. So, you say, well, I go to the bathroom frequently. I wake up 3 times a night. I wet my pants. I have overactive bladder. What's so hard about the diagnosis? Well, what's tricky is there are 2 categories of overactive bladder. As I often explain to patients, there is provoked overactive bladder and there's unprovoked overactive bladder. Okay. Provoked overactive bladder means it's not actually a problem with your bladder. You feel problems with your bladder, but the source of the problem is something else. The most easy to understand and common example of that is prostate enlargement in men. Okay. As men, we urinate through the center of our prostate shaped like a donut, we pee through the middle. As we get older, the prostate grows into the center of the donut till we're peeing through a pinhole. Okay. Most guys have a bladder that is strong enough to force urine through the pinhole. So their complaint is not a slow flow necessarily. Now the flow is a little bit slower, but that's not their complaint. Their complaint is that they urinate too frequently. Why are they urinating too frequently? Well, they're not emptying all the way and their bladder's getting irritated, right? That is not the same as somebody who just has an overactive bladder just because. That's a provoked overactive bladder. The treatment for that man will not be these overactive bladder medicines. It will be prostate treatment. Now, if you fix the prostate and they still have an overactive bladder, that's a different story, right? Then you have to follow this overactive bladder pathway. But for most guys, the answer is the prostate, not the bladder. Same thing for women. You might say, well, women don't have a prostate. It should be easy to diagnose overactive bladder in a woman. Well, they have other things that could provoke overactive bladder, particularly like we talked about, the bladder dropping. If your bladder has dropped way down into the vagina, you may be urinating uphill. If you're urinating uphill, you may not empty. If you don't empty, you're going to urinate frequently, right? This is not primary overactive bladder, right? This is provoked overactive bladder from having a bladder that's fallen or prolapsed. The solution to that is going to be to fix the prolapse, not to treat the overactive bladder, right? So this is where the diagnosis is tricky, and you probably do need to talk to a urologist who can ask you a host of symptoms and perform a physical exam and really nail down whether your problem is your bladder or something else that's irritating your bladder, okay? Next, once we've shown that you have unprovoked overactive bladder or the problem is with your bladder, the next thing we do is talk about lifestyle changes, okay? Now, I always think the discussion about lifestyle changes is interesting because in my experience, the vast majority of patients have already made lifestyle changes, okay? There's not very many people out there who come to your office and say, I'm urinating 5 times a night. You say, well, are you drinking coffee at bedtime? And they say, oh yeah, I'm drinking 40 ounces of coffee at bedtime. I mean, people understand that if you drink caffeine, you're going to urinate more often. If you chug water, you're going to have to urinate. I mean, the concept of what goes in must come out is pretty intuitive, okay? But there are certain things that, maybe aren't so obvious. There are certain foods that can irritate the bladder, right? There are certain medications that people may not realize have a diuretic effect. They may not realize they're on a water pill and that's part of it, right? So the first thing to do is try to adjust when you take your water pill, try to limit caffeine and alcohol and spicy foods and limit fluids after dinner time and those kind of things, right? But generally, most people are going to do those on their own, okay? The place where you start getting kind of plugged in with doctors and urology is when that doesn't work, okay? So oral medications are the next step, okay? The issues with oral medications are, one, they have the potential for side effects. Any medication has a potential for side effects. So, we have to start at a low dose. We may have to try different ones, okay? But it's reasonable to try that, okay? And then if oral medications don't work, or if the side effects are intolerable, that's where we move on. That's where we move on to advanced therapies, or what we call third-line therapies. So lifestyle changes are sort of the things that we kind of talked about. You say diet, avoiding spicy food or bladder irritants. Exercise is an interesting one. So why would exercise help incontinence? Well, certainly exercise, or just generally having a healthy lifestyle, has a number of benefits, but it's not always obvious why that would help the bladder. Part of it is when you're carrying extra weight or you're living a very sedentary life, you may start to pool fluid in your legs or in your lower body. That's called edema. You're kind of sitting around, maybe you're gaining a lot of water weight, right? And that water will generally pool to the lowest area because of gravity. Then at nighttime, when you put your legs up to go to sleep, all that water gets reabsorbed and presto, you're urinating all night long, right? So living an active lifestyle or healthy lifestyle can help. Bladder retraining, biofeedback, this is one that, again, I think is for some patients, not for everyone, okay? Bladder retraining is really for people that have gotten into bad habits where they're excessively urinating because they've sort of trained their mind to do that. So this is for the patient who used to drink 50 ounces of coffee a day because they were working 100 hours a week. And so they just got in the habit of going to the bathroom every 45 minutes, right? Now they're retired. They don't drink all that much coffee, but their bladder is just used to urinating every 45 minutes, right? These kinds of, you can retrain your bladder if that's what it is, right? But if you have a significant overactive bladder where there's something wrong with your bladder and it just doesn't hold urine properly, you can do biofeedback or bladder retraining all you want. You'll unfortunately wet your pants, right? So these are specific patients. And then pelvic floor strengthening or Kegel exercises. Again, this is for stress incontinence. This is for, your urethra's fallen down a little bit, or you just had your prostate removed for prostate cancer and you're dribbling urine. You can tighten up your sphincter and you can hold urine better. This is not going to help a problem with an overactive bladder, okay? Which brings us to oral medications. Now, oral medications are very effective at increasing the bladder's capacity, okay? There is no doubt that these medicines work great. These are medicines like oxybutynin or myrbetriq or Vesicare or trospium. There's a lot of them, okay? But the way that they work is they generally work by paralyzing the bladder, okay? By partially paralyzing the bladder, they allow the bladder to fill more and give you more time to get to the bathroom. The problem is paralysis of the bladder can have certain side effects. It's not like you can take this medicine and just say, okay, I'm done. I'm fixed. You know, these medicines require you to be monitored, because you may remember that another problem that happens with age, or that happens in people that have long-standing bladder issues, is urinary retention. And if you paralyze somebody's bladder, even partially, you increase the risk of urinary retention. So in one sense, when you use these medications, you're sort of trading one problem for another. You're trading the problem of a small bladder for a weak bladder, a paralyzed bladder. Now that may be okay to a point, but you can't just keep increasing the dose of these medicines, or inevitably you'll end up on the other end of the spectrum where you can't go at all, which is just as bad or worse of a problem. The other issue is these medications have a very drying effect. They dry out your mouth, they dry out your eyes and cause blurry vision. They dry out your bowels and cause you to be constipated, okay? Finally, a lot of them cross the blood-brain barrier, and they can cause unsteadiness on your feet or dizziness, okay? Memory issues and dementia. That's not a problem for a 48-year-old. That is potentially a very big problem for a 78-year-old. You know, we should not be taking medications that increase confusion and dementia and unsteadiness after age 70, because obviously that's the group of people that are at risk for falls at nighttime and confusion at nighttime, this kind of thing. So, you know, upwards of 50%, maybe up to 72% of people actually have to stop these medications because of either the side effect of excessive bladder paralysis or these other types of side effects that we talked about. That's what leads us to advanced therapies or third-line therapies. If the medicines don't work, or if their side effects are intolerable, you know, a lot of people give up at this point, but this is unfortunately way too common of an obstacle to just give up on, right? This is actually where we need to get a little bit more sophisticated and a little bit fancier in our treatment. So one very, very common treatment is Botox, okay? Now, you know, I'll often say it's just like Botox to crow's feet around your eyes. You know, if you look inside somebody's bladder, that's called a cystoscopy. That's part of the workup or the diagnosis of bladder problems. An overactive bladder, it looks overactive. It looks wrinkled. Okay, well, we don't call those wrinkles wrinkles. We call them trabeculations. We give it a fancy term, but it's essentially a wrinkle. It's a piece of the bladder that won't relax. It's constantly contracted. It looks like a wrinkle, just like a crow's foot around your eye, or just like any other wrinkle. You can inject the bladder with Botox, and you can relax it so that it'll hold more urine. It is very good at doing that, and it will do that for 6 months, okay? It is a very, very good treatment for a specific patient, and it is a very wrong treatment for other types of patients, okay? And the way I'll generally describe it to a patient is Botox is a great option. It's done in the office. It's, you know, it'll last for 6 months. You can do it twice a year at your usual visits with your urologist. It's a great treatment if you have a strong bladder. Botox is a paralytic agent, and it is a much more potent paralytic agent than any of those medications, okay? So it is basically a stronger form of those medicines that will not carry side effects of dry eyes, dry mouth, mental confusion, dementia, okay? That's the upside. The downside is that it will paralyze your bladder much more significantly. And if you have a weak bladder to begin with, whether that's due to age, whether that's due to just generally having weak muscles because you're out of shape, deconditioned, you know, have had previous surgery, have had previous bladder prolapse, whatever the reason, if your bladder is weak and you inject your bladder with Botox, there is a risk that you will be unable to urinate until the Botox wears off, which means you have to self-catheterize. So Botox works very well. It's very easy to do, but it is only for a specific class of patient. And the older you are, or the weaker that you think your bladder is, the more careful you have to be about a medication like Botox. Our other third line therapy is the InterStim device. The InterStim device is an option for anybody with overactive bladder, but it is the only option for people that have a weak bladder when the medicines don't work. The way the InterStim device works is it is essentially a pacemaker for the bladder. It connects to the nerve that goes to your bladder midway between the spine and the bladder. And using electrical stimulation, it restores the bladder to function appropriately. What does that mean? It means to hold urine appropriately, to limit the frequency of urination, to cut down on urgent needs to urinate and therefore cut down on incontinence. And in my opinion, most importantly, it does not weaken the bladder's function. In fact, it is pretty much the only treatment for somebody who has an overly weak bladder. So if your bladder is flaccid or doesn't function, the InterStim will actually help it function better, which is the exact opposite of Botox and hence incredibly important for a lot of patients with overactive bladder. Okay, this technology has been out there for many years, 25 years now. It's been there since 1997. It is very minimally invasive procedure. It does not require general anesthesia. I've done it just with local, but most people will have a little twilight like you're having your colonoscopy. Okay. And nowadays there are rechargeable devices or recharge-free devices and batteries that last longer than 10 years. So, it's not something where you have to keep going in to get your shot every 6 months. You kind of put it in there and just kind of forget about it. Okay. The other thing that I think is extremely important is the InterStim device can be combined with all of the other treatments for overactive bladder. So if you have a medicine that helps you 80% of the way, right? And that's not good enough. Then you try the Botox and the Botox helps you 90% of the way, right? You won't necessarily be able to combine the Botox with that medicine to be 100% better because, again, that's too much. Those are both paralytic agents. That's too much paralysis for your bladder potentially. The InterStim, on the other hand, doesn't paralyze your bladder at all. In fact, it strengthens your bladder. So if the InterStim device gets you 90% of the way there, you can take a very low dose of the medicine to get 100% of the way there. A very low dose of the medicine that probably wouldn't cause those side effects we talked about, dementia and other things like that, right? If you're lucky, the InterStim device may even get you 100% of the way there, but the very nature of medical treatments is we don't always get you 100% of the way there, but with combination therapy, maybe we would. So, there's a lot of specific benefits to this versus some of the other treatments. The way that this implantation is done is we don't just implant the device. Generally what we do is we do a trial. You don't want to have a device put in you unless it's going to work. The trial is done very, very quickly. Takes about 15 minutes. It can be done in the office or it can be done with a very light twilight sedative and x-ray guidance. And we just put the lead or the wire down to the bladder nerve and you carry the device in a little strap around you for a couple of days, between 3 days, 4 days, 5 days, however long you feel necessary, and you evaluate how you do. Okay. If you feel that it helped you, then you get it implanted. This device, I'll say from personal experience, but most of the studies will agree that approximately 85% of patients find that it helps them very quickly and want the device implanted. Okay. And 85% sounds pretty good, but it's even better than it sounds because you have to remember these are patients that medicines didn't work or Botox didn't work. These are the toughest patients to treat that get a trial of this device. And of those patients, 85% have a good experience with this device. So it is a very, very successful and sophisticated treatment for overactive bladder. If you have a good response with the trial, we implant it in you. Again, even the implantation procedure is still not done with general anesthesia. It's a very quick procedure with just a light sedative, like a twilight, and a very small incision. The device is usually implanted through about a 1-inch incision. The incision is over on your buttock on one side or the other, kind of up in a little pocket where it shouldn't interfere with anything. You go through the airport, doesn't set off any airport, security measures. It doesn't generally cause you to have problems with MRIs or anything like that. Those are all older iterations of this. At this point, this technology has come to the point where basically it's in there and you kind of forget about it once you put it in, once you get it set properly. 84% of patients that use it are satisfied. It's significantly more effective than medication. You can see most estimates have it about 3 times greater improvements than medication. And 76% of people, who do a trial have success with it as compared to the medicines, which are, closer to a 50-50 or a coin flip. So is this therapy right for you? Well, this is a complicated question. This is something where you really need your doctor, specifically your urologist, to evaluate you and make sure that, as we talked about, you have unprovoked overactive bladder, right? You don't have, your overactive bladder is not because you have a big prostate or because you have significant prolapse or you have a scar in your urethra that obstructs you and prevents you from urinating. This has to be for a bladder problem. And that you've tried the easy stuff. You've tried limiting your caffeine. You've tried cutting out spicy food. You've tried some of these medicines from your primary doctor and you haven't had success, then that's when you consider third-line therapies. So what happens next? Well, if you're suffering from these types of issues, you have to find a specialist and you talk it over with them. You shouldn't be shy about it. You shouldn't be nervous about it. This is as important for your general health and certainly very important for your quality of life as anything else might be. You shouldn't have to suffer from a bladder that doesn't let you live the life you want to live. So at this point, we'll open it up for any questions.
Thank you so much, Dr. Siv. It was so great hearing about all of that. I do have some questions for you here. The first one being phrased as such: I visited another urologist and went through protocol. The medications did not work. Would I have to start all over again, or can you get records from a previous doctor?
Oh, you should definitely not start over all over again. Okay. There's no, especially with medications, which can carry side effects or which you stopped for a reason, you should never start from the beginning. What I would recommend though, is that you are re-examined. Okay. The urinary tract, it's a sophisticated, collection of organs. And what you need is any doctor that's going to do anything to you should always do their own exam. They should check the position of your bladder if you're a woman, evaluate your prostate if you're a man, look at the internal anatomy of your bladder. Do you have those wrinkles or trabeculations? What's your bladder capacity? Those type of examinations should always be repeated because most of us urologists have learned that you can't go by somebody else's description of your patient's bladder. You got to examine it yourself. But certainly there's no reason to repeat using the same medicines again or using Botox again or repeating x-rays again. All that stuff isn't necessary. It's just the examination components and the discussion that should be repeated so all the right information comes through.
Thank you. Will this test affect my pacemaker?
No. When you have a pacemaker that's already in there, we'll always get your cardiologist's approval to have any sort of a procedure, right? But there won't be any interaction between your pacemaker and this device.
Wonderful. Will this help someone with prolapse?
Well, that's a complicated question, actually. So, will it fix the prolapse? No. I mean, if your bladder has fallen, right, it's down. It needs to be pushed up surgically or non-surgically. But there are women that have a minor prolapse where the issue is not prolapse, but rather overactive bladder. You can have both. And in fact, it's very common to have both. So this can help the symptoms of overactive bladder. But this won't help to push your bladder back up into place, no. But this can help some of the problems you can develop as your bladder is having, frequency or urgency or incontinence, which can coexist with a prolapsed bladder.
Gotcha. Thank you. What other conditions do you commonly treat?
So I basically treat the full gamut of urology with a focus on minimally invasive therapies. So, most commonly, in addition to overactive bladder, things like prostate enlargement, kidney stones, sexual dysfunction. And then I have specific training in minimally invasive and robotic cancer treatments. So, robotic removal of prostates or kidneys or bladders for cancer.
Wonderful. Thank you. Where all do you service? What areas?
So I have 2 offices that are where I see most of my patients. One is in the Sun City, Peoria area, and one is in the Sun City West Surprise area. I am also opening an office in the Goodyear area at Cancer Treatment Centers of America as well. So basically, most of the West Valley is fairly close to one of my 3 offices.
Thank you. And the last question for you here, how do I make an appointment? Does it have to be online?
No, in fact, probably the easiest way to make an appointment is to dial the number that you see there on the screen, 623-546-1400, and just make an appointment that way. If you'd like to make an appointment online, you certainly can. You can go to my website, drsiv.com. That's DRSIV, drsiv.com. And you can fill out the form there and someone will contact you for an appointment that way as well.
Thank you so much, Dr. Siv, for hosting this event with us tonight. It was extremely informative and we are so grateful for your time. Thank you all for joining with us. Please jot down the phone number for Dr. Siv's office so you can schedule an appointment. Much of what was discussed tonight is relevant to so many of you, but each and every person is unique, so it's always beneficial to make an appointment and discuss it with your physician. If you don't mind, please fill out the short anonymous survey once the event concludes. It will appear on your screen and be emailed to you. Thank you again and good night.